Okay.
Who is it?
Hi, my name is Vanessa. I'm going to be your nurse today.
Okay.
Can you tell me what's going on with you today?
My throat hurts.
Your throat hurts?
Yeah.
Can you tell me how long your throat has been hurting?
Like 2 days.
On a scale of 1 to 10, with 0 being the least amount of pain and 10 being the worst, can you tell me where your pain is?
7.
7. Have you taken anything for your pain?
Yeah.
Motrin? Okay. How many Motrins have you taken?
As in today.
Today?
1.
What time?
1.
Is that helping your sore throat pain? It is? Okay. Have you had any fever?
No. It was a 99.2, I think.
Your fever, you've had a 99.2 temperature?
Yes.
Alright. Does it hurt when you eat and drink?
Yeah.
Is there anything that makes it better?
Medicine.
Just medicine? Is it better when you eat warm things or cool things?
Warm. Well, I guess both, actually.
Have you had any cough drops or anything?
Yes.
But what makes it feel best?
Warm stuff.
You said cough drops help?
Yeah.
Okay. Has anyone at school been sick?
Yes.
Yes. And what have they had?
Strep throat.
Alright, well I'm just going to continue to ask you some questions, okay? And in a minute we'll get to your physical exam. Do you have any significant past medical history?
I had a concussion.
Okay, well, just a second, I'll ask you about that, okay?
Okay. Since that, no.
Oh, I guess you can go ahead and tell me about your concussion.
Playing softball. I got it April 1st. This summer.
This summer, okay. So how did that concussion happen?
I guess I was running to second base and a girl hit me in the face, apparently.
Yeah.
And I hit my head on the ground, and apparently I got knocked out.
Okay. And did you go to the doctor?
Yes.
Did they do a CT scan or anything?
Yes.
Yes, they did a CT scan, and it was negative, but she did have confusion for about 48 to 72 hours after the concussion, and she had to sit out of sports for about 2 weeks. Are your immunizations up to date?
Yeah.
Okay. Do you have any allergies?
Nope.
Medicine or environmental? Do you take any medicines?
No.
Just Motrin? Okay. Alright, so how old are you?
13.
And where do you go to school?
Right, middle school.
Okay, can you tell me what you do at prep schools? What sports you're
Basketball
involved
and
in?
softball.
You play basketball and softball? Do you have friends?
Yes.
Okay.
Very
How,
many.
you have a bunch of friends?
Yes.
How would you say you get along with your peers and your teachers?
I get along with them very well. I never get in trouble.
You never get in trouble.
With my teachers.
Good. Who do you live with?
My mom and my dad and my 3 brothers.
Okay. What other things do you do besides go to school?
Go to church.
Go to church?
Yes.
Okay. Wednesday, Sunday?
Yeah.
Okay.
And then whenever it's not too hot or too cold, sometimes we'll go to the park or the track and run.
Okay. With your family?
Yes.
Okay. Can you tell me what you eat for breakfast every day?
Usually cereal or maybe peanut butter toast, and then I'll have a glass of milk. Sometimes almond, sometimes chocolate. 2%.
Okay. And what do you have for lunch?
Usually a peanut butter sandwich, chips, and water. Usually a peanut butter sandwich, chips, fruit, and water.
Okay. And what do you have for dinner?
Just depends on what my mom makes.
Okay. What does she usually make?
Food.
What kind of food?
Like soup, whenever it's winter, and then
usually we have a protein and a carb and a vegetable with our meals, and we usually drink water. Occasionally we'll have something else, but we don't usually have pop. Okay. Growth and development. And she has developed, she weighed 5'5" when she was born, and she has never had any developmental delays. She's met all the milestones, doesn't have any significant medical history, no cerebral palsy or anything like that. Are you sexually active?
no. Gross. No.
Okay, now I'm going to ask you a little bit about your family history, okay? Okay, your mom, does she have any significant health problems? Mom is 31 and she has a history of kidney stones and four natural births. Dad has a history of childhood asthma and he is 33. She has a 10-year-old brother that has a history of asthma, and a 3-year-old brother and a 1-year-old brother that have no significant health history. Have you ever been hospitalized? Do you have you ever received blood?
What?
A blood transfusion? No, she's never received blood, and her blood type is O positive. Is there any significant health history in your family? Yes, her grandmother has no significant history. She's 51. Her grandfather, paternal grandfather, has a history of prostate cancer that's in remission. She has maternal grandmother has no significant health history. Maternal grandfather, we don't make contact with him, so we are unsure of the history, and that's all we're aware of. Okay, can you tell me overall how healthy you are?
10.
On a scale of 1 to 10, you're a 10?
Yes.
Yes, I would say that's true. She's maybe sick once a year with a cold or something like that. She's probably had antibiotics maybe 4 or 5 times in her life. She catches the occasional cold now and then, but no significant medical history. And she sees a doctor probably about once every 2 years for a checkup follow-up. Her last visit was a few months ago for her tetanus vaccine. All right, Riley. So, can you tell me have you had a sore throat before?
As in before I got sick.
Before today, have you ever had a sore throat? Okay. Have you ever had strep before?
Yes.
All right. Do you currently have a headache?
No.
And have you had an injury to your head recently?
Yeah. Well,
today?
April. No,
not today. Not since you've been sick now, right? Just in April. Okay.
Yeah.
No syncope. You don't feel like you're going to pass out or dizziness right now?
No.
Okay. All right. Have you had any pain in your neck besides your sore throat? Notice any tenderness in your neck? Soreness? Okay, or swelling? Okay. You don't wear glasses.
Nope.
Okay. She has 20/20 vision. She doesn't wear glasses. Do you have problems with your nose? I need to know, are you stuffy? Do you get a runny nose? Do you get nosebleeds?
I don't get nosebleeds, but I do have stuffy nose or runny, depending on the allergies and stuff.
Okay. Do you smell okay?
Yeah. Yep.
Do you have any sores in your mouth?
No.
What do you do to keep your mouth moist?
Water.
Do you have any cavities?
I've only had one in my life.
I know you drink water, but do you do anything to keep your lips moist?
Chapstick.
Oh, just regular chapstick? Okay. Alright. You don't have a dry mouth. Have you had any difficult speaking or saying words or bad breath, voice changes, or excessive salivation? No? Okay. No trouble chewing? Do you have any pain, lumps, or tenderness in your breasts?
No.
Okay. No tenderness or swelling in your lymph nodes? Okay. Have you had any trouble with shortness of breath, wheezing, or coughing?
Only after I run.
Okay, but since you had the sore throat?
No.
Okay. Do you have any chest pain?
No.
Feel like you have a fast heartbeat or skip heartbeats? Do you know if you've ever had rheumatic fever? You get rheumatic fever. Have you ever had rheumatic fever?
What is that?
No, she's never had rheumatic fever. Your gastrointestinal. Okay. So how would you say your appetite is?
Perfect.
Perfect. Do you eat good? Do you eat none?
I usually eat pretty well.
Okay. Now, have you ever had heartburn, where it feels like it's burning up your esophagus?
No.
Or reflux, where it feels like it's burning in the back of your throat?
No.
No? Do you have excessive gas?
No.
Diarrhea?
I've had it before, but I was sick.
But not right now?
No.
Okay. Have you ever noticed any blood or your stools a dark color?
No.
Okay. Do you ever get constipated?
No.
Okay. Would you say that you can pass your bowel movements just fine?
Yeah.
Okay. What does your urine usually look like?
Either clear or sometimes a little bit yellow.
Sometimes a little bit yellow or clear?
Yeah.
Okay. Do you feel like after you go pee that you completely empty your bladder?
Yes.
Okay. Now you said you're not sexually active. Have you started your period?
Yeah.
When was your first day of your last period?
Monday.
Monday of this week?
Last week.
Well, beginning of this week.
Beginning of last week.
Okay, so you haven't like grown 10 feet in a month, have you?
I wish.
Okay. No funny your hands haven't excessively grown, or your feet, or anything like that. You don't have diabetes. Okay. You feel like you have to pee and pee and pee all the time, or that you're very, very thirsty? No. Okay. You haven't noticed that you have like hair growing on your chin or anything like that? Okay. So, would you say that you can physically run around and do all the things that you need to do to participate in basketball and softball?
Yep.
No problems? Okay. Have you ever had depression?
No.
Nervousness?
Yeah, before a game.
Before a game, that's normal. Yeah. Anxiety or tension?
No.
Okay. All right. Now, Riley, would you say, how do you say that you feel about yourself as a person? You do? Okay. Do you feel like I need to know specific things about yourself. Like, do you think you're friendly? Do you think you're nice? Do you think other people like you?
Yeah, usually.
Okay. Do you think you're friendly?
Yeah, if I want to be.
And nice?
I'm usually nice.
And nice?
Yes.
Okay. Do you feel like you're well liked by your peers?
Yes.
Okay. Have you ever contemplated suicide?
No.
How do you feel about your body? Like your body image. Do you think you're too fat? Do you think you're too skinny? Do you think you're just right?
I guess I'm fine.
You guess you're fine?
Yeah.
So are you confident